Yeah, imagine someone who's playing in the Philharmonic, the violinist, the main soloist in the show. Do you know how much they practice since they've been 3 years old? They've been practicing the same sonnet over and over and over and
Okay.
over. And when they stop, they miss that note. Implant dentistry, surgery, restorative, smile design, making teeth, coloring teeth, all of that has to be like a classical music. You need to practice it over and over and over. And the more you do it, the more frequently you do it, the more it just flows. And you can see, you can feel the doctors that don't do it all the time, they struggle, they second guess themselves, they're not sure. So cases that should take 35 minutes end up taking 4 hours. And cases that should take 2 hours end up taking 8 to 10 hours. And imagine if the patient is sedated. Scary, right?
Yeah.
Imagine the doctor says you're going to be sedated for 2 hours. Next thing you know, you're sedated for 8 to 10 hours. These things are all going to come out. And these are questions that the patient should ask. How long is my case going to take? If they say it's going to take 8 to 10 hours, that's an answer you should run. It shouldn't. If you're a full arch dentist and you're doing this all the time, the cases should not take more than 3.5 hours, maximum. And that's for the full mouth, max. And that's the teeth, the implants, the extractions, the bone graft, everything. That's how long the whole thing should take. Not more than that, not less than that. And it will get faster for the guys that do it all the time. But remember, you could do it all the time wrong, but you do it all the time right. And that's really the testament of time. One of the things I always do on my social media is I post my cases from 2, 5, 6, 8, 10 years ago to show that they look exactly the same way today than they did 10 years
But